Fireside conversation. We are pleased to have here Anna Bartlett from the Welsh Government, the perspective from the Welsh Government Social Welfare. So round of applause to Anna on the seat. It's David Teague from ICO Wales and Dave Parsons, who are going to be also speaking in a lightning talk afterwards, but they are going to help themselves in this fireside conversation as introduced. The floor is all yours.
Oh, I'm not going to sing and dance now. Afternoon, everybody. My name is Dave Parsons. I'm the manager within Digital Health and Care Wales for the Wales Accord on the sharing of personal information. It's something I've been part of for, it'll be 20 years in November, believe it or not. I think somebody else said this morning, I haven't worked here for 20 years, I don't look that old. But yeah, I've been involved in information governance and assurance for 23 years now, 20 years in local government. 3.5 years now in Digital Health and Care Wales, leading the WASPI team. I'll hand over to my colleagues before I talk any further.
Thanks, Dave. I'm Anna Bartlett. I work in the Welsh Government in part of the Digital Data and Technology Directorate. My role is to lead on data ethics and data sharing, so I have close links with Dave here. I have responsibility for certain bits of Mission 6 of the digital strategy for Wales, which is around data and collaboration, particularly around making sure that data is available and is reused ethically, safely and securely for the benefit of citizens in Wales. Been doing this for about 8 years now. I kind of fell into it. I'm quite happy to explain how I ended up here at some point. But kind of key things that I've done over the last few years was the introduction of the Data Sharing Powers and the Digital Economy Act to Wales. Also leading on the data governance around the data sharing elements inherent in the clinically extremely vulnerable population during the COVID pandemic, and also our Nation of Sanctuary response to the war in Ukraine. And I will hand over to David.
I've got my own microphone. I feel like a bit of a loner because I'm the bad guy here as the person that does the regulating of all this work. So my name's Dave Teague. I'm the Head of Welsh Affairs for the Information Commissioner's Office. For those of you who don't know, the Information Commissioner is the UK regulator for data protection and information rights. It's not just data protection. How many people here have heard of data protection, by the way, and or know a little bit? Oh, God, that's excellent. When I started doing this job, 0 hands would go up there because nobody pretended to know about it. And I'm delighted to be here today. Ivan's fire has gone out, unfortunately, so it's going to be a slightly different sense of a fireside chat for us, I think. But we do work really closely together, all these institutions here, to make sure that things are in place in Wales to facilitate good data practices. We were looking at the headlines for this about this being around trust and ethics and compliance. How do we engender trust in that? So I thought I would start because data protection laws in the UK, you'll have your own laws all around the world, almost certainly. Again, that wasn't something that was in place 20 years ago, but mainly they are now. And I was really interested in Steve's Three Dragons approach there because I think the laws actually reflect that approach quite nicely. And from my perspective, if you comply with data protection law, you will automatically engender trust, and you will automatically consider the ethics of what you're doing with data. And the reason is that there's quite a few things built into the Data Protection Act 2018, and now the Data Usage and Access Act, and also the UK GDPR. So we've only got 3 to choose from, but they all cover everything nicely. And what we're looking at there is that some of the cornerstones of that. One is transparency. So data protection law is all about the rights of us as individuals. Every one of us here today has a lot of rights under data protection laws. One of those is the right to be informed. And we've heard the word transparent spoken quite a lot today. The other quote I picked up from this morning was something that Helen Thomas said, was that if you put people at the heart of what you do, like DHCW say they do, then you will automatically be doing the right thing. And that's very much the case with data protection. Because if you're transparent, you've got to tell people what you're going to do with their data, and that allows them to then make informed decisions about that data as well. You've also got to tell them why you're doing it and your lawful basis, to get a bit technical under the law as well. So there's lots of reasons under transparency that will help engender trust. And if you get that right and you're open and upfront, quite often people will follow. I was having a really interesting conversation with somebody in genomics recently who said that for people with rare diseases are much more likely to give full consent for their data to be part of studies and part of research, as opposed to people with fairly common conditions, perhaps, or lower, less serious conditions. And I think that can be reflected in the transparency of the information you give out. And the other issue then is around the ethics. There's a fairness principle. The very first principle of data protection says it should be lawful, transparent, and fair. And fairness is where ethics come into it for us, because you should be doing, before you process data in certain new ways and exciting new ways, you should be doing something called a data protection impact assessment, which allows you to see what the likely impacts are. One of the first starting questions is, why are we doing this and what do we want to achieve? Quite often answering that will go into the subject of the ethics of doing that. And on the subject of ethics, I will hand over to Anna.
Thank you. So my role is twofold. So I'm going to talk about data ethics rather than data sharing. I'll leave data sharing to Dave. So we can see data ethics in Welsh Government as being compliance with the law and compliance with the GDPR principles of fairness, accountability and transparency, but it is also wider than that. So GDPR only covers identifiable data. Data ethics asks you to think holistically about all of your data use. So are you using aggregated data? Are you using statistics? Are you using them to make decisions? Is that an ethical way? Are you using it ethically? And one of the things that we try and get people to think about is it may well be lawful. Doesn't necessarily mean it's ethical, doesn't necessarily mean it's fair in a holistic way. And the other thing we ask people to think about is that data itself isn't neutral. You know, we talk about data as a thing. It's not neutral. How it's gathered, what it was gathered for, who gathered it, can introduce bias that we may not recognise some way down the line, particularly if we start reusing data that was gathered for one purpose for another. Is that the right thing to do? Does it tell us everything that we need to know? Are we introducing bias by the fact that we're using this particular data set over here and it was gathered for a purpose and we're trying to reuse it? So it's really important to think kind of very broadly about all forms of data use, be that personal identifiable and compliance with UK GDPR and the Data Protection Act and we're calling it the DUA Act now just for ease, helps you comply with that element of it, but it doesn't help you think about the wider uses of data and the wider types of data that governments and public authorities may well be using. There are lots and lots of tools out there to help you assess the ethics of what you do. People in statistician type roles, people who do social research, so they're well used to conducting ethics assessments, but maybe operational teams are less used to doing that, but they are taking decisions that are driven by data. And I take Steve's kind of point on what does data driven mean, and by this I mean they are taking decisions informed by analysis of data rather than an algorithm making a decision for them. Where this starts for us is that you need to think about it early, and I think David would agree that the data protection impact assessment and your data ethics assessment is one of the first things you do, if not the first thing you should do, rather than we're going to decide to do something and then start thinking about the data and the governance a little bit later. I'm going to hand over to Dave so he can talk a little bit about data sharing and governance.
So we're often known as the Mythbusters, the three of us. I think we should come up with some kind of Ghostbusters sign behind this. But just a show of hands, because I'm interested, I ask this question every time I go to a conference. How many of you have come across a scenario where somebody has said, can't do that because of data protection? It's a constant. It's something for the last 20 odd years has occurred. I mean, when David and myself started in this industry, and we were both working in local government 20 years ago, we would ask that question in every single training session, and David will know that because he came to some of mine at the time. But it's a really important question to ask. So one other question I've got. We've mentioned about ethical assessments, data protection impact assessments, the term DPIA. How many of you have come across that term, the DPIA that you need to complete? I'm going to take a bit of responsibility for this because I was one of the very first practitioners in the IG world to actually come up with a data protection impact assessment based from the ICO guidance back some 10 years ago or so, and it seemed to have just taken off. But it's the vital component to anything, because everything we want to do is for the benefit of individuals. It's for the benefit of our patients. It's for the benefits of our service users. But what you've got to do is sometimes just strip it back and go, what is it we're trying to achieve? How do we achieve it? There's been a common theme for me today, and it's interesting because I'm not going to give away my little lightning talk that I've got a bit later. But we talk often in Wales about some of the frameworks that we lead, and we talk around the terms culture and collaboration, and that's been mentioned throughout today. And a lot of it really is down to culture and collaboration and how we also improve another C, which I won't give away yet. I like to do a little bit of audience participation. So at this point, I'm going to ask you all to do something. I want you to go to the person next to you and share your date of birth, or if you don't want to share your date of birth, just a memorable date that means something to you. Just for the next 60 seconds. Well, we're all comfortable talking, so that's a good thing, right? Have we all shared it? Has everybody now shared a date? Yeah, yeah. Several dates in some cases, yeah. Right, this is going to get a little bit more tricky now. Then, can you all get your mobile phones out if you haven't already? Could you pass it to the person that you just shared your memorable date with? I wonder how many of you actually use that one of those that code to get into your phone. I bet some of you do.
But it's tricky because we are people that we are pretty concerned about it.
There is a reason. There's a reason why I've just done that. Sometimes we will ask people to actually open up their mobile phone and actually share the mobile phone with the person next to them. I mean, the purpose behind that for me is it's about confidence, isn't it? I mean, how did you feel? Anybody want to put their hand up to talk and tell me and give me feedback? How did you actually feel doing that? Were you nervous, apprehensive? No? No, pretty comfortable. That's a good sign. That's how the world is starting to move in the right direction in one respect. But think of it from a practitioner perspective. If they've suddenly got a request from, I don't know, say, a safeguarding officer, from the police, or even just from somebody internally in an organisation saying, can I have this information? Can you share this information with somebody? How do you think they feel? And often than not, what we always come across are people that will go, well, that's a bit too difficult to deal with, that's a bit too hard, I'm going to put that in a box that's too hard and just go, I can't do it, I'm not going to do it.
But it was the same question with priests in the past.
Yes. But the point is, what we've got to do, and this is the other C for me, confidence. It's for us, it's our responsibilities to instill confidence in the staff that we work with, in the organisations in which we work with, and with our partners. Because if we instill confidence, actually the law and the things that we talk about are there to actually help guide us and to support us doing things. I always leave the message when we talk around data sharing and data protection, that is, the law is actually there to help us do things in the right way. We're not barriers. Which is great, but usually when I do, I always tell them it's your role, it's our role to actually find solutions and make things happen in a way that can actually comply with the law. So it is just a take. It is a confidence thing, but culture and collaboration is what you need in order for things to be really successful in the world of data sharing, really. And with that,
And I can definitely vouch for that, having liaised with several hundred organisations, particularly when GDPR was coming in years ago. Those that have got a good culture, a good secure culture, we talked about risk appetite earlier as well, if that's all got good rationale behind it, then that equips staff who are maybe sometimes at the coalface, at the front line of delivering services, to be able to give those messages of trust and confidence to people, and then people are much more likely to have that trust in the project or the processing that's taking place as a result.
Yeah, I'd agree with that. And I think the thing we've found in Welsh Government is that data protection, data ethics is sometimes seen as a barrier. They're not. They are an enabler. And I hope you kind of got the sense that we feel that from this, and that it enables us to make good decisions about what we do with data that don't then lead us to really difficult consequences somewhere down the line. So comply with GDPR, and obviously there's clear risks to getting that wrong in terms of fines and reputational damage, but that's less clear when it comes to non-personal data. Doing data ethics assessments properly and thinking things in the round. So in Wales, we ask public authorities to think about the Equality Act and our obligations under that, about our obligations under the Wellbeing of Future Generations Act, and all of the wider pieces that we ask people to think about, help people make properly informed decisions about whether this is a good use of data or not, that doesn't then in 5 years' time go, oh, damn it, we've done something wrong because we didn't think about it here, which is why I've always said, do it right at the beginning. Because one of the things about doing ethics well is that it builds trust by making it clear to people that if you identify a problem early on, you can change what you're doing or stop doing it entirely. And I think the thing that is really important for me as a kind of data ethics professional is that if you identify issues that you cannot mitigate, you should stop. That doesn't mean you don't do it. It means you need to rethink and reorientate. But being willing to do that builds trust with the public. Doing that transparently and openly is a really good thing and helps us make good decisions as government, as public authorities, and also helps build trust in the public in what we're doing with their personal data, but also that we are using data in general to make decisions that impact them in an informed and safe and ethical way.
I guess there's 3 words I always use, and that is document, document, document. I think that really is the key to how, from an assurance perspective and from a regulator perspective, we can always, be able to, step back and go, actually, we've considered this, we've done our due diligence, we put the right things in place. And if we're challenged then by a regulator or by an individual, at least we can, confidently be able to, set out where we've considered things. I mean, data sharing is a challenge. I mean, from a health perspective, we've got fantastic data sharing that goes on in Wales. We're very fortunate. I'm extremely fortunate that I've got a service that underpins and supports all of our public services and third sector in Wales, and we brought loads of organisations together, and it really does help. But a couple of colleagues this morning have mentioned that some of the key things that they could really do with our standard governance structures, and they are really important. I think standards really do help. If you look at it, why have we all got our own versions of data protection impact assessments? Why have we all got our own versions of, data controller agreements? We don't need multiple versions of things. We've all got to comply with the same requirements, and it's about bringing people together. So, I mean, Wales, we're very fortunate. We've got that kind of structure. We've got those standards, and we brought the public services with us over the past 20 years. Ironically, I would say, and I think this is a fair comment as well, that the pandemic actually brought us closer together. It proved that if you had some standards and structures, you could do things. I think colleagues previously have said today that unfortunately sometimes when you're pressed with a situation, that really does bring the light while you do something, and sometimes privacy becomes the last thing on the mind, and we'll deal with that afterwards. And I think that's true to a point. But what I do also think it's really demonstrated the pandemic did the opportunities that are there if we can do things in the right way, and if we engage and collaborate in the right way as well. So hopefully when I get to my lightning talk in a little bit, I can share with you a little bit of what we've done in Wales. But I do think that standards really do help, and I think that the pandemic did bring a lot of us closer together, to be fair.
Yeah, I'd absolutely echo that. We were heavily involved in an advisory capacity, but just to make sure that everything that was happening with data in Wales was in accordance with the Data Protection Act, because we all wanted to try and get to, and the pace that we were moving at was ridiculous, turning over legal documents overnight sometimes, just to make sure it was there in place. And it can be done when there's a need and there's a public need for it. Just on Dave's point there's a lot of templates out there already. There's no point in reinventing the wheel if somebody's done something. Certainly on the ICO website, shameless plug here, by the way. On the ICO website, it's all free. There's loads and loads of guidance. There's data protection impact templates. There's everything you need to know about sharing agreements. We've got our own UK code of practice, data sharing code of practice, which is ably supported by WASPI, the WASPI framework, which we've been part of for some time. There's a lot out there. And we've talked a lot about AI as well today. I think that's been one of the key takeaways for me, how important that is. As arguably the regulator in the AI space in the UK, we've already got some guidance out there on what you're doing with the algorithms, how you can be as transparent as you can be with those. And also, again, shameless plug, on the 14th of October, we've got an AI basics session at our Data Protection Practitioners Conference, which is an online event. So feel free to go to our website or see me later, and I'll show you how to register for that. You only got to attend the one session if you want to, so because it's all online. So shameless plugs done. Thank you.
I don't have many shameless plugs, unfortunately. We rely really heavily on the guidance provided by the ICO and by what was the Responsible Technology Adoption Unit, part of the Department for Science, Information and Technology at UK Government, is now Government Digital Services. They have a data ethics section. They provide a lot of guidance. It's currently under review, but it is helpful. I just kind of go back to the point around stuff. I'm not going to pretend it was easy. It wasn't, but we were able to embed privacy, data protection, data ethics less so because it wasn't so much a thing we were thinking about. But data protection was embedded from the start. The first thing I did was start a DPIA. And that it does involve a wide team, but it's not the barrier that people seem to think it is. It can be embedded from the beginning. Privacy by design is the phrase that you use. We had WASPI engaged really early on, and it actually helped us make really good decisions about the data that we were able to use, who we were able to share it with. That was perhaps more informed and perhaps a little bit more risky than some of the decisions that were taken in England. So we were taking health data, sharing that with our local authorities because they're at the front line of delivering services to the most vulnerable people. But we also were able to take an informed decision with the help of the ICO that we could share that data with the supermarkets, because those people needed food and they needed priority access to delivery slots that were like gold dust in those first few weeks. So we were able to take that decision that we could share a limited amount of data with a private sector, several private sector organisations. UK, England level didn't feel able to do that. So embedding it early isn't a barrier. I think the point I'm trying to make is it's an enabler. It helps you make good decisions.
And there were differences in the two sharing mechanisms there, which is what, it's those subtle differences that can make all the difference, funnily enough. And I think we were working there, we actually had a joint arrangement with 33 different organisations, all under one data protection umbrella at the time, which was unheard of. But the pandemic did throw up some interesting things that we had to deal with. So to get that over the line was tremendous. And we had the 4 nations of the UK all having slightly different approaches to how they responded to COVID as well. So which was, again, something that was not known to us at that time, really, was it?
No, and we were able to take the lessons that we learned from COVID into our Ukraine war response. And I think England was too, but I'm less familiar with how they went about it. But we took a number of the products that we developed, data sharing agreements, a data protection impact assessment that's focused around the data share. So it asks very specific questions about who you're sharing with, why, how are you moving the data, and all of that, into our Nation of Sanctuary response, with Dave's assistance on an ISP, which was the 33 signatories, which was done within 3 months, something like that, from beginning to end. Yeah. So it's not a barrier. Yes, it needs some resource. It needs a little bit of time, but it shouldn't slow you down, which is the thing I hear a lot. I suspect Dave hears a lot, is that this takes too much time. It doesn't. You can do it if you want to.
Yeah, and I guess the last thing for me is, whilst things are much, much better now than they were 20 years ago, and they really are, data sharing challenges are still out there. We still see those headlines, those missed opportunities from a UK perspective on a regular basis, the missed opportunities of data not being shared between agencies with particular partners, resulting in, harm or even in some cases, worst case scenarios in relation to children and vulnerable people. And it's really important that, whilst we focus on all the good things that we can do across health, is that we remember that we do also have our other public service partners who are equally important, because we're data rich actually in health. For someone that's come from local government for 20 years into health, it's been really eye-opening for me, and the opportunities we've got for the data that we have to actually open up and share collectively. I promised Anna I wouldn't mention too much about the Digital Economy Act, but it's got real legs and opportunities for us in Wales to, really expand upon things even further to allow us to share even more. Don't know whether that's what the ICO want me to say either, but I think it's absolutely the right thing to be promoting. But yeah, there's a lot more to do. We're in a very, very good place, I think. I will do a shameless plug, because Dave and his colleagues have invited me to the Data Protection Practitioner Conference this year, and we are going to be talking around data sharing challenges and opportunities. So if anybody wants to find out a bit more about it, feel free to also jump onto the panel I'm sat on, as well as Dave's as well, next month. Any questions, I guess, for us?
I'm not sure how much time we've got left, Paul, but happy to answer questions.
1 minute.
If anyone's got a really quick question, yep, got one over there.
I had 3, so I've got to choose my favourite one now.
Oh, well, Anna.
So I really enjoyed the panel discussion, and obviously leading the National Data Resource in Wales, and having managed a lot of data sharing, I can vouch for the support that we get from colleagues to keep us safe when we do that, and have those processes in place. So I suppose my question was more around the ethics, because I think the law is very easier, right? It's black and white. You're either abided by the law or you're not, and there's consequences when you're not. I suppose when it comes to ethics, some of that can be quite subjective, because someone might think it's ethical and someone might not think it's ethical. So I guess my quick question on that was really what does good look like in terms of ethics assessments, and actually what are the consequences if we consider something to be an unethical use? And then if you want to fit in another one really quickly, my other question was about how do we go about having the right conversation with the public? So we talk a lot about trust, and there is a conversation to be had, isn't there, about what does that mean, and what do we use your data for, and how do we protect it? And I suppose a view potentially from government really on how we take that forward. Thanks.
You're alluding to a data promise there, aren't you?
I don't think it's that anymore, is it? I'm not sure.
No, I don't think it is. I will be very brief, because I know we haven't got a lot of time. What does good look like is an evolving picture. Yeah, what ethical data use looked like 3 years ago now looks very different, with the increasing use of AI and algorithms and just machine learning, data science. It all looks very, very different. I think I'll go back to Dave's 3 words, which is document, document, document. Document your decisions. Look at the obligations under the Equality Act. Assess those impacts on different demographic groups, particularly those under that are specifically named in the Equality Act, but it doesn't need to be limited to those, and it shouldn't be. and keep that alive is, for me, the thing that I can't tell you what the best practice is for a data ethics assessment. They change. UK government are currently reframing theirs, and that will look very different to the current one, which is helpful and it asks good questions. But it's to keep it alive, keep going back to it in the same way that you should be going back to a DPIA. Things change, things move. Keep it alive, keep asking those questions. How do we frame those conversations for the public? That's a really difficult thing. Transparency is key. We know about our obligations to be transparent when it comes to personal data, but I think it's less clear about what our obligations are, and they're more moral obligations than legal ones when it comes to use of non-personal data. And I think that's something that, as Welsh Government, we're still kind of grappling with. I think UK Government are grappling with it too. If you have any ideas, please come talk to me.
This may be an unfair question because I'm not sure jurisdictionally now how it works anymore, but about 3 weeks ago, the European Court of Justice has changed the long-standing view on pseudonymization for data transfer, and I'm just wondering, does that affect the Welsh thinking at all, or have you had time to digest the finding?
Oh, you've got one. Oh, I'll get one. The email hit my inbox last week, and I don't think we've really given it a great deal of thought as to what this actually means for us yet. There's a lot of thinking ongoing around the DUA Act, Data Use and Access Act now, what that means, and I suspect it's all kind of caught up in that thinking, but it is something we're aware of. What it actually means in practice for us, I don't know. Dave, do you have a view?
No, it's something we're obviously taking into account, and we'll be reviewing our own guidance that's out there on anonymisation and pseudonymization. Just for me personally, there's always been a fine line between the two anyway, because arguably if you engineer a process to take it, to depersonalize it, you can reverse engineer it. It's a question of where the mechanisms are for re-engineering it that says how unlikely or likely it is. We have got mechanisms in Wales that are working around that. They will be being reviewed in accordance with that. It's a little bit too soon. We're still reviewing all our guidance with the new Data Usage Act that's gone through as well. So, but watch that space, I would imagine.
Fireside chat. For this conversation, I see that this trio is used to work together, so we benefited from these excellent presentations.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare. Better diagnoses and treatments. Making healthcare smarter, one innovation at a time.
Venture into the frontiers of healthcare data innovation with the Health Data Forum. Welcome to the Health Data Forum's YouTube channel, your gateway to thought-provoking conversations, cutting-edge insights, and groundbreaking advancements in healthcare data. Join us as we explore the transformative power of data to revolutionize healthcare delivery, patient care, and societal well-being. Embark on a journey of discovery. Delve into healthcare data through our informative videos, featuring leading experts, thought leaders, and innovators. Discover how our global movement, Data First, AI Later, is building a strong foundation for ethical and impactful healthcare solutions. Experience the collaborative spirit. Be a part of our vibrant community of health data enthusiasts, where ideas converge, partnerships flourish, and innovation takes center stage. Participate in discussions, share your perspectives, and join us in shaping the future of data-driven healthcare. Stay informed about the latest developments in healthcare data through our comprehensive video library. Catch up on insightful interviews, thought-provoking presentations, and engaging discussions about the role of data as the backbone of healthcare transformation. Join us in shaping the future of healthcare. Let's harness the power of data to transform healthcare for the better. Subscribe to our channel today and become part of the Health Data Forum's mission and our Data First, AI Later initiative to make healthcare data work for everyone.